The unit provided by the Ann Arbor VA and the community-based outpatient clinics is the Ultima 5 Digital TENS unit. It includes one TENS unit, 4 leads, 1 battery charger, 2 1.2 volt rechargeable AA batteries. These batteries are partially charged at the factory. 4 self-adhesive pads, 1 additional set of batteries, and 10 sets of electrodes will be provided as well. To assemble the unit, remove the battery cover from the back of the unit and insert the batteries with the negative ends against the springs. Place the cover back on the unit by sliding it from the bottom along the grooves. Remove the leads from the Ziploc packages. If using 1 channel, remove 1. If using 2, remove both. Insert the plugs into the jacks. Either lead can be used on either channel. Now remove 2 or 4 electrodes from the pouch. You will need 2 electrodes for 1 channel and 4 if using 2 channels. Ensure the area to be treated is dry and clean. Do not place the electrodes over areas where you have used lotion. You may need to shave areas where electrodes will not stick due to the presence of body hair. Pull each electrode off the plastic sheath, placing them approximately 3 or 4 inches apart and surrounding the primary pain site. Do not place on bony areas, spinal cord, heart, or implants of any sort, such as pacemakers or pain units, for example. When operating the TENS unit, open the panel in the front of the unit by pulling back on the tabs on each side of the unit. Press the large round button on the right to turn on the power to the unit. You will have 9 pre-programmed settings to choose from when using the unit, or you may decide to customize a program to your preference. The provided programs are constant, 1 through 3, burst, 1 through 3, and modulated, 1 through 3. To choose between these programs, press the Mode button until you reach the preferred program. After choosing a program, decide how long you would like to treat the area and push the Clock button, the middle button on the bottom row, until the appropriate number of minutes appears. 15 to 30 minute increments are provided. If you so choose, you may set it on C for continuous, in which case you will need to shut the unit off manually. Otherwise, it will shut off after the set number of minutes have passed. Now lift up on the tab of the clear plastic cover at the top of the unit. Turn up each knob until you can feel the electrical impulses. Turn it up to the level of intensity that you prefer. This should feel comfortable, and the intensity does not need to be high to be effective. There should not be any muscle twitches. If so, reduce the intensity by pressing the button again, or if needed, place the electrodes in a different spot. Press the round power button again to lock the setting and close the top and the front panel to ensure that it snaps closed securely. Place the unit in a pocket or hook it on your belt securely using the pocket clip provided on the back of the unit. Remember to tuck the wires securely into a pocket or waistband. Be careful not to pull on the clip aggressively in order to prevent breakage, as it is not designed with a spring device. When you are done using the unit, ensure the power is turned off by pressing the large round power button inside the front panel for about 5 seconds or until the screen goes blank. Place each electrode back on the plastic sheets from where they originally came and back into the plastic Ziploc bag. They will be good for several more treatments before they will no longer stick to your skin. If no longer sticking, you can reactivate the glue by wiping the damp finger or alcohol pad. They are usually good for 1 to 2 weeks depending on use. If in a sweaty area, you can spray with antiperspirant but not deodorant. Check the skin after treatment and do not reapply electrode until skin is not red. Choose a different spot. You may choose to keep the wires and electrodes attached to the unit and gently wrap the wires around the unit for storage, or remove them from the leads and place them back in the pouch between sessions. To charge the batteries, open the charger by pushing on the tab at the edge of the charger at the bottom edge below the clear plastic cover. Place one battery on each side by placing the negative end or the flat end against the metal flaps, which you will need to pull down. Snap each battery into place and close the plastic cover, snapping it into place. Pull up on the prongs in the back of the charging unit and plug it into the wall socket to charge overnight. When the unit stops working, replace the batteries with the other set provided. Upon changing the batteries, recharge the dead ones. Never use a TENS unit if you have a history of cancer, pacemaker, or seizures, or are currently pregnant unless specifically cleared by your doctor. For any questions or to reorder supplies, please contact the Physical Therapy Department at your VA. Thank you.